A whole new range of cosmetic skincare services, all of them non-surgical, are now available at the Iowa Clinic Plastic Surgery Department. European facials help you feel relaxed and rejuvenated. Deep cleansing and detoxifying, they leave your skin looking and feeling exceptionally clean and fresh. For those with facial blemishes, wrinkles, or uneven pigmentation, a Gliderm chemical peel can improve and smooth the texture of your skin by removing damaged layers. An acne treatment facial is designed to treat oily, dry, dehydrated, and acne-prone skin. It helps refine enlarged pores and improve skin's overall clarity and texture, and is a great way to maintain good skin health. Areas of special concern, like your eyes and lips, can also be treated. And we offer several skincare lines to help protect, renew, and restore your skin's natural moisture.
There is a myth that the term plastic surgery comes from patients looking plastic or fake, or even the use of plastic type material like silicone or collagen. And that's not where the term plastic surgery comes from. It's from the Greek word plastikos, which means remodel or reconstruct. And now it's kind of divided into there's reconstructive surgery and there's cosmetic surgery. But a good plastic surgeon should be able to and should do both things. The myth about Botox is that it is a dangerous poison. The reality about Botox is that used in small amounts and used appropriately, it is an excellent tool for facial rejuvenation, to make a patient look younger, and to prevent aging. The best place to place Botox, where it is FDA approved and seems to have the most bang for the buck, is right here in the glabella region, which is the area between the brows. That's where people sometimes tend to have a heavy frown, and it prevents the frowning and prevents the vertical creases that are made in your skin after years and years of frowning. We also will frequently use it in the crow's feet area, that people develop crow's feet from a lot of squinting, and it can prevent that. It can be used in the upper brow area to prevent wrinkles there, and also on the midline area of the nose. Some places where Botox has been used but doesn't work as well is in the neck for the platysmal banding here. And people will frequently ask about it in the nasolabial fold area, but that's usually not a good place for it. You will see in magazines and you'll see on TV commercials about anti-aging creams, creams that lift, and those usually are ineffective. And people spend a lot of money on that stuff, and I don't think it works. I think Botox does work, and although it does require an injection, it is a very effective way to rejuvenate the face and to help slow down the aging process. There is a myth that an injectable filler such as Restylane or Radius or Juvederm create unnatural looking facial features, big puffy lips, and a face that's not animated very well. And in reality, fillers can be used to decrease creases in the face, wrinkles in the face, and to, once again, do very good anti-aging or rejuvenate the face. But it needs to be done correctly, and it needs to be done in moderation. You can tell sometimes in a patient that's had just too many things done to their face, and it doesn't have a very pleasing effect. But if a patient has wrinkles in the brow area here, or along the smile crease from smiling too much between the cheek and the mouth, those can be filled out with a filler, and if it's done correctly, it actually can decrease that creasing and make a patient look 5 to 10 years younger and rejuvenate the face. There's a myth that when a plastic surgeon operates on you, there will be no scarring, that somehow we have a technique that we cut the skin and scars are not created, and that's not true. Scars are created, but hopefully we're very good at concealing those scars, and we hide the scars in clever places, particularly for elective operations. For a facelift, the scar is in the hairline and back around the ear. For eyelid surgery, it's hidden in the eyelid crease. Breast surgery can be underneath the fold. So we place our incisions in good places to hide them. However, if you have a mole or have some type of traumatic accident to you, the scars that are left, it's hard to move those. We can use good techniques to camouflage them, or scar revisions can be done at a later date. But there is a myth out there that somehow a plastic surgeon doesn't leave any scars behind, and that's not true. We're still working with skin, and when you cut the dermis full thickness, there will be a scar. Hopefully it'll be a very nice scar that fades over time. There's a myth in plastic surgery that, for example, a breast augmentation patient is a young woman that's doing it for their boyfriend or for their spouse. And in my experience, that is not true. The typical breast augmentation patient tends to be in their late 20s or 30s. Maybe they've had children, and then after they've had their pregnancies, the breast tissue involuted. In other words, it went from, let's say, a B or C cup down to an A cup, and they want to restore that femininity that they had when they were in their early 20s. That, to me, is the typical breast augmentation patient. It is not eccentric women or very wealthy women or women that just are doing it to please somebody else or want to look, you know, fantastic in a bathing suit, although usually they do after we do the surgery. The typical patient's a soccer mom in their 30s. The myth about silicone is that it's dangerous, it's poisonous, that it causes all kinds of problems. There were many women in the 1980s that had silicone breast implants placed for cosmetic augmentation. And the silicone back then was more of a liquid nature to it, and they did have some problems. There was episodes of rupture, there was a firmness of the scar, which is called the capsule that forms around the implant, and a lot of women that went in for cosmetic surgery on their breasts had less than ideal results. These days, the silicone is a more cohesive type of gel, so even if it ruptures, usually we don't have the problems that we had in the past with firmness, lumpiness, and thickness. But you can still have a problem with silicone, but we do believe that it's very safe in terms of the fact that it doesn't cause any other systemic illnesses such as diabetes, lupus, rheumatoid arthritis, which is what the concern was back in the 80s. You want to have the smallest scar possible, a saline implant is a better choice. But if you want the best, most normal feel possible, silicone tends to be the better choice. There's a myth out there that liposuction can take an overweight person and make them skinny, and that's not true. The ideal liposuction patient actually is fairly skinny to start with, but they have a little pocket of fat, let's say in the hips or in the lower belly or maybe in the neck area, that they, no matter what they do, they just can't get rid of that fat. That's the perfect candidate for liposuction. If you are overweight or obese or morbidly obese, liposuction is not the answer. Diet and exercise, getting down to a more ideal weight is the way to treat that. And then if you have a pocket of fat that just won't go away and good skin that will retract after liposuction, that's the perfect candidate for liposuction. My recommendation is if you are going to have plastic surgery done, make sure that your surgeon is board certified by the American Board of Plastic Surgery. Or there's similar types of boards. Let's say if you're going to have a skin type procedure done, make sure that it's a board certified dermatologist by the American Board of Dermatology or the American Board of Facial Plastic Surgery.
For more information about the non-surgical or surgical services we offer, please contact the Iowa Clinic Plastic Surgery Department at 515-875-9744.